In this video, let's talk a little bit about what the likelihood of having another surgery is if you are contemplating either a cervical disc replacement or a cervical fusion. One of the really common concerns that patients have if they're undergoing any type of spine surgery, especially if it's a fusion, is what is the long-term consequence of that surgery? What is the likelihood that I am going to need another surgery in the future? There is relatively good data for cervical disc replacement and cervical fusion, and I wanted to share that with you. At about 10 years, the rate of needing another surgery in the literature after a cervical disc replacement is anywhere between about 6% to 9 or 10%, depending on the study that you read. The rate of requiring another surgery after a fusion or an ACDF is about 15%, so a little bit higher. One of the things that I would like to point out with regards to these numbers is some patients have a conception or an understanding that one surgery means for sure, or they are destined to have another surgery. And in the literature, actually, a single level anterior cervical fusion that's performed, the rate of needing another surgery at 10 years is only 15%. So it's really not very high. 85% of patients do not have another surgery at 10 years. And the rate of the cervical disc replacements is, in the literature, a little bit lower than that. And it will be interesting to see over time what the 15-year data looks like and what the 20 and 25-year data looks like. There are several things that can be done after surgery to prevent adjacent segment problems as well. And I feel like mindful movement, plenty of sleep and rest, but also good nutrition are some of those things. We encourage our patients to work a little bit with physical therapy after surgery, and then to engage in regular activity and to, again, have good nutrition after surgery so that hopefully your rate of needing another surgery at 10 years is zero. That's not going to always be the case, but maybe there can be some things done to decrease the likelihood that if you were to have one surgery, you would have another. And again, the overall rate of needing another surgery after a cervical disc replacement is anywhere between 6 to 9%, and after a cervical fusion is about 15% at 10 years.